Welcome to Senior Talks, an exciting new educational program for those ages 45 and older in Harris County, Texas, that features presentations on opioid use, medication management, recovery, and health. Senior Talks is sponsored by the Harris County Area Agency on Aging and Wellderly program through the Council on Recovery. Today, we have Leah Bell, older adult peer recovery specialist, who's going to talk to you all about recovery, part 1. Take it away, Leah.
Thank you. Hello, and welcome back to Senior Talks. Today's discussion will be over recovery from addiction. The objectives of today's discussion is to revisit what addiction is by definition, excuse me, review and understand the 6 phases of addiction, and lastly, we will learn about the 6 stages of change. What is addiction? Webster's definition for addiction is a compulsive, chronic, physiological, or psychological need for a habit-forming substance, behavior, or activity having harmful physical, physiological, or social effects and typically causes well-defined symptoms, excuse me, such as anxiety, irritability, tremors, or nausea upon withdrawal or abstinence from the substance. This is a state of being addicted. Their second definition of addiction is a strong inclination to do, use, or indulge in something repeatedly. All right, so now let's recap on a seniors talk discussion we had in one of our earlier segments, which was on what is addiction. You may recall we talked about the why and the how of addiction. One reason why addiction happens is that of a genetic cause. Research have found that close to, if not more than 75% of individuals whom are suffering with the disease of alcoholism or drug addiction has a biological trait for the disease, which means it can be hereditary, just like any other disease that may pass from the parent to the offspring. Another reason why addiction happens is due to some environmental risk factors, such as being raised in a chaotic home environment, families' outlook or attitude towards alcohol and drug use, the community's outlook or attitude towards alcohol and drug use, being neglected or abused as a child, even abuse as an adult can trigger misuse, which can lead to addiction. A few other factors are economic and social status, education, and more. So now we have reviewed the why. Let's now shift our attention to the 6 phases of addiction, which details the how addiction happens. The first phase of addiction is the initial use. While not everyone's initial use will lead to addiction, those who fall into any of the risk categories mentioned above will have a higher probability of developing alcoholism and or other drug addictions. So then it stands to say that the more risk factors an individual is exposed to, the likelihood of becoming addicted is increased. For individuals who has a predisposition for the disease will go on to phase 2 and begin to abuse the substance. Phase 2 being abuse. What this means is that they are using more of the substance and more often. However, there will come a time when the same amount will no longer give them the desired effect, at which point they will enter into stage 3, tolerance. Now, a greater amount of the substance is needed to produce this desired effect. Tolerance is an indicator that the brain has been altered, which then tricks the individual into believing they need the drug. As tolerance is established, the individual will begin to intake larger amounts of the substance to produce the desired effect. The cycle will lead to the individual developing a dependence on the substance, which is stage 4, dependency. At this phase of addiction, the person will experience physical or physiological withdrawal symptoms in the absence of the substance. Needless to say, the individual will use to avoid them. Before long, the individual will succumb to full-blown addiction, which is phase 5. At this point, even if the individual wanted to stop, they couldn't. Despite all of the alcohol, drug-related problems they are experiencing, such as problems at work or school, problems with the law, problems with their health, their family, and other relationships. They are now addicted and unable to stop on their own. For some who are able to stop, they may not be able to stay stopped, which is phase 6 of addiction, which is known as relapse. For many, it is too much for them. They cannot do it alone. I like to pose a question to you. Would anyone choose to be a diabetic or choose to have high blood pressure? I think not. Addiction is not a choice. It is a disease as well. However, if they cannot stop, there are moments when the individual wants to. They know deep within the core of their very being, they need to change. But the disease of addiction is a disease that challenges the individual's ability to process their thoughts. Denial, rationalization, justification, isolation, guilt, and shame, they all set in, which in turn makes it difficult for the individual to change. Now let's look at the 6 stages of change, which is an extensive category, but for the sake of time, we will condense the material. Stage 1 is the pre-contemplation stage, which is the first stage of the stages of change. People in the pre-contemplation stage typically do not consider their behavior to be a problem. They may be, and this may be because the consequences of they may not have the negative consequence of their behavior, or it may be the result of denial of the negative or severity of the consequences they may have experienced. When people are in the pre-contemplation stage, they're often not very interested in hearing about negative consequences or advice to quit their addiction. Stage 2, contemplation stage. Stage 2 is the contemplation stage. The word contemplation essentially means to consider or think about something deeply. Someone at the contemplation stage is generally more open to receiving information about the possible consequences of their addictive behavior. They may be open to learning about different strategies for controlling or quitting the addictive behavior without committing to a specific approach or even promising to make a change. Now, even though they may not make you aware that they're thinking about this, they are. Contemplators typically benefit from non-judgmental information giving and motivational approaches to encourage change rather than confrontational methods. The third stage of the stages of change is preparation. The preparation stage of change means the person has moved forward to planning and preparing for carrying out the changes they have learned about in the contemplation stage. With substance addictions, Thorough and thought out preparations can be important to success. During the preparation stage, a person may plan the kind of change to be made. They may, which might be to cut down, harm reduction, or to quit completely. They might determine how to make the change. Again, if they're like, how much should they reduce their drinking to? Obtain necessary resources may be another thing a person in a preparation stage may look into. For example, it may intend to go to treatment to stop drinking, and will need to find agencies that can assist them in finding the appropriate treatment facility for them. They might get rid of all of their triggers, which is their tangible triggers, such as, so these triggers could be reminders that can trigger craving and make it hard for them to avoid addictive behaviors. Triggers can include wine bottle collections or favorite wine glasses. Letting go of these reminders can be difficult, but the process can harden the resolve to overcome their addiction. And finally, they may put support in place. Support can include informing friends and families who want them to improve or overcome their addiction. They may look into booking a place in a detox or treatment center, or finding a support group. They can even inform their using buddies to no longer engage with him in such a manner as addictive behavior goes. There may be many other preparations that need to be made in your specific circumstance, such as finding a clean, safe place to start your new life. If you need help from a counselor or social worker, this is the time to get it. They may also be able to help you with other preparations. Once the necessary preparations has been made, a person is typically ready to move on to the action stage. Stage 4 of the stages of change is, again, the action stage. The action stage is the focus for many people attempting to overcome addiction. This is the stage at which real change of behavior starts to begin to happen. The action stage is typically stressful, but with good preparation, it can also be exciting and give way to new options. For many people, the action stage starts in a detox or treatment center. Here, trained professional provides support through the early phases of discontinuing an addiction. Depending on the goals that are set, in this contemplation stage, and the plans that are made in the preparation stage, the actions can occur in small, gradual, or it can be a complete change. It may feel strange and even empty to be living life without your addiction. It takes time to get used to life without addiction, even if your support and alternative ways of coping are good. Identifying and developing effective ways of coping with stress are crucial during the action stage. This will allow you to this will help you to effectively move to the maintenance stage without experiencing a relapse stage. Stage 5 is the maintenance stage. And in this stage, this stage is concerned with continuing to achieve the progress that has begun in the action stage. For people with addiction, this means upholding the intentions made during the preparation stage and the behaviors introduced in the action stage. Excuse me. Usually, this will mean staying abstinent from alcohol or drugs, keeping to a reduced level of addiction behavior, sticking to limits, avoiding people, places, and things that are associated with using behaviors. The maintenance stage is the most challenging. After a period of time has lapsed and the focus on reaching the goal has lost its intensity, people can become complacent at this point. They may begin to think that a small lapse will not really matter or make a difference. Maintenance also becomes difficult when the stress of life catches up and resurfaces. This is why it's important to learn new ways of coping with stress during the action stage, so the alternative strategies will be available to you during the maintenance stage. And lastly, stage 6 is the relapse stage. The relapse stage is sometimes included in the stages of change model, in recognition that a person might have some or even many small lapses or even relapses. With the addictive behavior the addiction behavior is taken up again before the maintenance is achieved. In reality, the outcome of the process of change is highly individual. Some people are able to adjust to controlled drinking, use drugs or addictive behaviors without becoming addicted. For others, abstinence is the only way to keep their addiction under control. Sometimes it is only after several relapses that a person discovers what recovery from addiction means to them. So don't give up. Remember, recovery is highly personalized. Some get it quickly and some get it slowly, but recovery is possible if you work it. So in conclusion, to the process of change, the stages of change. The stages of change is the road map in and out of recovery. This concludes this segment of Senior Talks. If you or someone you know are in need or are struggling with an addiction, please call the number provided on the screen. And as always, we thank you for joining us at Senior Talks.